in the kitchen today watching an underappreciated but incredibly important side of winning, hygiene. If your team is sick on the sidelines, it's almost impossible to win. We'll be following two things today: how to stay on the sidelines to prevent sickness from spreading, and how to stay healthy and hygienic in the kitchen. First, let's look at what's at stake if health and hygiene protocols are not followed. Remember, diseases like norovirus are highly contagious, so practicing good hygiene, such as regular hand washing with soap and water, disinfecting surfaces, and implementing a good employee health policy can help reduce the risks of transmission. To prevent the spread of diseases like norovirus, we need to emphasize personal hygiene and a few key practices. Now let's look at the game plan that will keep kitchen staff and dining guests healthy and happy. Let's start with hand washing. It may seem simple, but washing for at least 20 seconds before handling food and after visiting the restroom is incredibly important. Watch John scrub those hands. Expert technique. His heart and hands are really into it. Now, personal protective equipment. We're not talking helmets and face masks here. We're talking gloves that are changed frequently in between handling different foods and after any time the hands become contaminated. Coughing and sneezing should be done into a disposable tissue or the elbow to prevent the spread of respiratory droplets. Finally, it's never fun to sit on the sidelines, but staying home when you are sick is critical to keeping patrons and fellow employees healthy. Stay home if you are feeling unwell and don't return to work until 24 hours after symptoms are gone with no medication. How do we get all this accomplished? Education and training are essential. Conduct regular workshops and refresher sessions on food safety and disease prevention. Also, post visual reminders throughout the kitchen and reinforce these practices during team meetings. Two key points here to execute the game plan. Regular inspections. The manager walks through the kitchen examining cleanliness, hygiene practices, and the correct implementation of food safety protocols. Open communication. The team engages in open and honest conversations, reporting any concerns or symptoms to their supervisors promptly. By doing so, potential issues can be addressed before they become more significant problems. Remember, our kitchen is not just a workplace. It's a place where we create delicious meals and memories for our customers. By prioritizing employee health and practicing proper hygiene, we ensure that our kitchen remains a safe haven for both our team and our patrons. And that is a winning formula.